important is exercise for general metabolic health, but particularly heart health? Because you're interested in fitness and improving people's fitness. So let's talk about
Absolutely. Yeah, absolutely. I think exercise has certainly gotten a bad rap, I guess you can say, because it's not the best thing to help with weight loss. Now, it can help with weight loss maintenance. It can help with the type of weight loss, make sure you're losing fat mass, not lean mass, but it's not like the number one thing to do for weight loss. So because of that, people start to think, oh, well, exercise is not that important. But that's not true either. I mean, it's very important for cardiovascular health. And whether you're talking about observational studies or interventional studies with surrogate markers, exercise does make a difference. It lowers blood pressure. It can lower long-term inflammation. It can improve blood sugar regulation and lower insulin and improve triglycerides and raise HDL. Like, it does all the things that you want to do to improve your cardiovascular health. And then just improving your VO2 max and cardiorespiratory fitness also correlates with improved cardiovascular health and decreased cardiovascular events. So many lines of evidence point to exercise being very important for cardiovascular health. But then, of course, the next question is what type of exercise? And there, I mean, the answer truly is whatever you're going to do, right? Because again, if you're told one thing is great, but you're never going to do it, then it's not great for you. But if I could design one exercise program for everybody, it would be one day with, pretty hard resistance training, then one day with zone 2 cardio training, then one day with interval training, and then one day maybe with mobility training, then one day back to resistance training, then one day back to zone 2. And then I would get all these different types of exercises in there. I think that's ideal. Are most people going to be able to do a program like that? No, of course not. But they have to find a program that's going to work for them that incorporates those basic principles.
And so this is when I think good or well-qualified personal trainers come into the equation. Some people need that support.
Yeah, absolutely. And that's one of the things I did that a lot of people thought I was crazy was, as a cardiologist, I went back and got my certification as a personal trainer. People are like, what? You're a cardiologist and you're going to class and training to become a personal trainer? And people thought I was crazy, but it was one of the more valuable things I've done, because it really helped me give exercise prescriptions, individualized exercise prescriptions to my patients, which I think is so valuable. And yes, we need more people doing that, and not just saying exercise more, move your body more. Like, what does that mean for most people? They don't know. People need guidance. Yeah.
I like that you call it exercise prescription, because
that's what it is.
We usually associate prescription with pills. So